Thank you very much, Zoe, and thank you for having me here today. As I said, this is quite a different part of the presentations today because mainly talking about education, which links very closely with what Matt's already described in terms of raising awareness of primary bone cancer in future health professionals. So that's a lovely picture of us. I think I'd like to start with just talking about the perspective of universities having a civic responsibility to the people that we serve. And this is an original advert for the University of Sheffield, which was funded by penny donations from local people in Sheffield. And I think there's a lot of people that work at the university have that real sense of pride in that, and also about giving back to communities. And part of the work that I do in the medical school is very much focused on that. The first couple of slides, I'm just going to go through a little bit of background to give you a bit of context if you're not familiar with the training of doctors. But this is a very important document that students all refer to in their training. The General Medical Council is a public body. They have a register of all of the doctors in the UK, and they are very focused on the training and education of doctors, not only at undergraduate level, postgraduate, but also while they're working as doctors. So the slide on the right there gives you a bit of an indication as the framework that we use, and this helps guide curriculums across the medical schools in the UK. There's a lot of work done in all aspects of the curriculum around patient-centred care, and certainly in Sheffield we talk to the students all the way through all 5 years of the degree about the patient being at the centre of care. So you can see from that slide, sorry, it's a little bit blurred, but there's lots of things going on around the consultation in a clinical area. But what we always talk about is ensuring that things are very much tailored to the individual as much as possible. That is the curriculum in Sheffield for undergraduate medicine. I'm sorry, it's very busy. It's not very easy to see, but what I wanted to highlight really was what I'm going to talk to you in a little bit more detail. So this is the research attachment, and this is social accountability placement. And they're the two key things that Ali and I have been working on with our medical students in terms of our links with the Bone Cancer Research Trust. So these are some of our students. In 2018, I think that was our first opportunity to work with the Bone Cancer Research Trust in terms of hosting students. They basically, many of you here will have been involved with the research over the years that the students have done. So the key documents that you've funded from Bone Cancer Research Trust, our students have been reaching out to members of BCRT to explore whether the themes from those findings resonate with your lived experience. And that's been really important, a really important driver in our research. I must just credit them all. Juliet, Lauren, Olivia and Rebecca are on this slide. And then the next slide on the right is Gali, Izzy, Martha, James and Sharon. And this student, Lauren, you may remember from, I think it was 2019, she was at the previous conference, and that was her first opportunity to present. So you can see how some of the experiences that they have through this kind of education help to develop academic skills for them, whilst also learning about lived experience. And I really want to just pause at that point and thank you for your input to that, because I think one of the things when you work with medical students and talk to them about their experience, one of the things that is most common that they reflect back is how important it is to talk to people with lived experience of particular conditions and how much they remember from those conversations about what it's like to live every day with a life-changing diagnosis. Moving on, the second placement that I referred to are what we call our community placements for medical students, and BCRT are one of our placements. So we work with approximately 90 organisations across the South Yorkshire region. Obviously, this is a slight exception being in Leeds, but we made an exception for a very important cause. So these placements, I'll just give you a little bit of background about them. So they're a 4-week placement in the 3rd year of study for students. So if you think about a traditional degree, they'd be near the end of their degree. But partnership working is really central to this. So what we're trying to do is to help students to learn about lived experience, to learn about living with disadvantage, health inequalities, social determinants of health, and the impact this has on people's lives, and also social injustice. What we do is we get the students to negotiate the aims and outcomes with the organisation. So, for example, Bone Cancer Research Trust might have a particular idea that they want the student to work on, a particular project, or developing resources. And then when the students come, they choose the project. So the students they're given a selection from a broad range of projects, and they get to choose their top 5, and they're allocated to one of their top 5. And as a result, what we're doing is matching the interest of the student with the organisation. So hopefully it can be a really fruitful partnership. In terms of learning outcomes for the students, it's understanding the wider causes of health inequalities, and social injustice, and also learning to serve communities. And it's one of the things that we know from research is that student doctors tend to not think about serving communities until later in their qualification or in their clinical works. They tend to be more focused on that. As a qualified doctor, and what we're trying to do is to sow seeds of change in them, to understand the challenges that people have, in order for them to think about social injustice and health inequalities at a much earlier stage of their training. It also really helps to broaden their skills in terms of thinking about advocating for patients and individually tailored support for people. And I also add on lived experience in that. I'm a huge advocate for that, and have been in the 20-odd years I've worked there. So just to contextualise it a little bit, in a range of organisations, so this is not just at Bone Cancer Research Trust, but the students are involved with lots of client work, so they might get involved on a day-to-day basis. The placements are always mid-November to mid-December, so in terms of the timing of the year, there's a lot of organisations at that point do work around Christmas and preparing activities and Christmas things, but also really important resource development. They do a lot of work around social media, so some organisations really value having young, bright minds involved with the tech side of things. Certainly students are much more savvy on that front than any of them. Well, I'll talk for myself, but yes. In terms of the other work, they can raise profile of the organisation, so developing material for websites, for example, or promoting activities. Some of the charities are quite small that we work with. And we also work with many schools, so they do a lot of work around raising aspirations for young people who perhaps have never met any medical students, or sometimes in some of the more disadvantaged areas, they've never met anybody that's actually been to university. So it's a really important way into communities for us. And they also do a lot of future development work, so focusing on service evaluation and research. So one of the things I think that has been a huge impact for yourselves in terms of the Bone Cancer Research Trust is these 4 students. So this is Dhruv, Palvi, Emma and Amy, and they were involved with this hugely successful development of the flashcards. So has anybody seen them? I'm thinking if you show of hands you might have seen them. Yeah, thank you. This is a little bit of a close-up of them. You can see that one of the ways that it works really well is the students bringing their knowledge and skills that they've obtained through their training so far and putting that into a resource that's of real benefit for an organisation. So I've put this up just to show you. I'm sure that they're available, and there's lots of links on the Bone Cancer Research Trust. Originally, they were developed, I think, in 2019 was the first year, and they were hugely successful. They were developed for medical students, and they were distributed for medical students at the University of Sheffield, and they went in a flash, pardon the pun. And then I think subsequent work has involved developing and dissemination of this for patients, both nationally and internationally, but also other health professions who you would come into contact on your journey. So GPs, physiotherapists, radiologists, and they've also been developed for dentists around bone cancer, skull and jaw. So they're a hugely successful initiative, and again, just credit to the students for bringing that knowledge and enthusiasm, but also working in a collaborative way, because it tends to be the best way to get good outcomes. In a subsequent year, the students then, in the interest of sharing, increasing awareness, the students went to Geeky Medics, which is a site that's used by students to practice frantically for their clinical exams, and they managed to get a whole section on bone cancer included in Geeky Medics, so a great way of getting young students involved. In terms of thinking about the way that we assess this kind of work, for the community placements, the students have a range of assessments. They're assessed by the person supervising them on their placement. They're then assessed in a peer assessment workshop, so they develop a 10-minute presentation, which can be a mini film, it could be a PowerPoint presentation, it could be a poster. It's very flexible to allow them to convey the learning from their placement. And then the final piece of individual work is a written reflection on their experience. And they're marked by academics in my team in medical education. And it's really just to reinforce that this kind of exposure to lived experience is something that has a real authenticity. So when you read the reflections from students who've had this experience, you can see that the learning is much more unique for them. In terms of the more general learning from this other placements as well, it tends to help students to learn about health inequalities and the impact that that has in a lifelong way for people. It helps them understand how community organisations work, how charities work. It also is really valuable for them to learn about other models outside the NHS. Obviously, in the UK, the students are training in the NHS, but it really helps them to understand the interface between health, social care and the voluntary sector, and how, when they meet a patient, for example, who has primary bone cancer, they may then start thinking, oh, when I was doing those placements, I remember that charity did a load of support for people, and it helps them to think more broadly about that. One of the things we know that it really works well is with enhancing communication skills. So in the work that the students do, whether that's in individual interviews with patients, or whether that's more in focus groups, or work around working with people in charities, it develops their communication around particular subject areas. And then in terms of that learning, what we get them to do is to reflect on that in terms of what it means for their future clinical practice. So it's quite a nice learning reflective cycle where they take what they've learned out in practice in communities and can apply that when they next meet people in hospital settings. One of the things that comes across really strongly in our evaluations for this is the mutual benefit that it has. So these placements in the community are funded placements, and they are funded at the same rate as clinical placements in the hospital to value the expertise of the community sector. But there's a huge amount of mutual benefit, and we get lots of positive feedback from the organisations about working with students, which is great to read. I think there's two quotes there, just give you an idea about what it means for the student. So the student in white, and then, the placement in white, and then the student experience in yellow. So just to conclude, I think one of the key things from the student placements here are raising awareness of primary bone cancer in future doctors and the way that that can be disseminated. And I think the flashcards, as an example, demonstrate how something can be disseminated quite easily at a national level. Listening to people with lived experience and working with community groups does promote a unique approach to their learning, and having the opportunity to reflect on that provides an authenticity which generally stays with students. As I mentioned, it helps them understand relationships between the health, social care and voluntary sector, and also in education in primary and secondary and specialist schools. And this is just one of the examples from the University of Sheffield about the commitment to the region. So thank you very much for listening. And that's it.